You know, most people deal with something about 20% of the population deals with chronic pain. We've got Dr. Connie CASEBOLT Carver, and you are Wellness by Design. You can do things for people that have chronic pain, and we're not talking pills.
That's correct.
Yeah.
So, you know, if you've had something for longer than 3 months, it's no longer acute pain, it's now chronic pain. And it can really affect quality of life and function. I mean, it's, I saw this with my own mother. She had rheumatoid arthritis for 35 years. And yes, the drugs somewhat controlled her symptoms, but she got horrible side effects.
Yeah.
And so we're here to offer kind of an alternative, hope for someone that is wondering, can they get rid of chronic pain?
Right. You mentioned those drugs, and of course right now the big topic and the big discussion in this country is about opioid addiction.
I know.
And so tell us about your approach and how, you know, that's something that's a concern for you and the way you treat your patients.
Yes, so if you're on opiates for as little as 2 weeks, you can get addicted.
Sure.
So we're trying to help people avoid medications if possible. And of course, our approach is very customized. And I'll give you an example. I have a couple that drives up from Columbia to see me. He had gout. One of our IVs fixed that.
That's
and he had been unable to get out of pain.
Twice.
She had a toothache. And we did a different procedure on her, and her toothache is gone.
Tell me, if someone comes in, I hate to say it, addicted to those opioids, is part of what you do get them kind of off that and get them doing something else?
The first step is, of course, to try to address their pain.
Yeah.
And yes, we have some modalities that we can use to help people get off opiates as well.
Okay.
In fact, we have a brand new therapy in our office called peptides, which there's not time enough to explain it on here. But peptides are short little proteins that can help our body functions be optimized. So we have IVs, injections, peptides, sometimes dietary adjustments, and we'll use whatever we need to try to get the body to be able to heal itself. So it's a remarkable approach, does not depend on drugs, and we have quite a success rate. My husband, for example, had a toothache. And again, I used the same procedure that I did on this lady, and he was actually told by 2 different dentists that he was going to lose a tooth, that the nerve was dead. And we actually, in his case, we put exosomes, which is a derivative of stem cells, right into the base of the tooth. And I can't promise that it would work for everyone, so you know, no firm promises, but I have 2 cases now where I've saved a tooth. Wow. From being pulled.
Well, you know, I just got through my ear, our producer said that I was her chronic pain, so maybe you could treat her for me.
We won't repeat the rest of that. You identified the triggers, and that's something that you're really cognizant of, and figuring out what causes it, and then treating that.
Yeah, and there are so many different triggers. It could be a chronic virus, it could be bone-on-bone arthritis. You know, we haven't talked about headaches. All kinds of triggers for headaches. So we take a careful approach and try to figure out the best customized for each person. But the bottom line is people shouldn't have to live with chronic pain.
Yeah,
so
you're right. And that's a pretty high percentage, 20%. You're talking
adults.
Right.
That's right.
Yeah.
So if you're sitting at home right now and you're like, hey, I've had this pain that has lasted more than 3 months. This is chronic pain. Yeah. What do I do? What is that first step?
Okay, so good question. Normally we have a person come in for a consult, and we do charge for that consult. It is with our clinic director. Her name is Ann Peart. But for those who call in today and mention that they heard about it on this show, we're offering that consult for free. She still has quite a bit of availability in December.
Well, that doesn't mean you have to come today, but...
Yeah, you have to come schedule an individual consult. Her name is Ann. She generally sets aside anywhere from 30 minutes to 60 minutes, just kind of depending. She'll go over the different options, and then of course if they decide to move forward, then they would see me. Then we're going to do our very best to try to help get them out of chronic pain.
But where are you located?
We are at 850 South Pleasantburg, 1 block from Cleveland Street, which is, as you like to point out, where the bowling alley is, which is now painted such a bright color you can't miss it.
I didn't know that.
And we're open Monday through Thursday. So I think the phone number hopefully is on the screen.
It has been cycled. Yeah, it is on the screen right now.
So just invite people to call in.
Dr. Connie, one of the things that you guys are really known for is also the technology, and you do injections. Tell us a little about the tools that you guys have.
Oh, yes. So we, I have taken several courses on joint injections. And so if we have people, for example, with arthritis, we can do a specialty injection into that joint, and we can use ozone. There are other things we can use, but the bottom line is those things that we're putting into the joint are going to start the healing.
And we're looking at a before picture right now.
That's right. That's a knee that was in pain. She had difficulty hiking, and we did, in her case, approximately 6 or 8 injections. And then the next picture shows that the knee actually completely repaired itself.
Wow.
Right.
So the cartilage rebuilt itself. We didn't use any steroids. We used ozone in her case. And now she can hike without any discomfort.
Wow.
And hopefully we headed off a knee replacement.
Well, you probably did. Well, now for a free consult, normally about $80 in value,
right.
And that's to sit down and talk with Ann.
That's
and
right.
Maybe
just mention that you heard about it on this program.
But do it today. Get in
yeah,
touch today.
call today
right?
and
Okay.
get yourself some hope.
Yeah, get your quality of life back. The number 558-0200. Talk to Ann, set up your appointment, and save about $80 on them by saying that you saw them on Your Carolina.
That's right.
Thank you
Thanks,
so
Doc.
much.
Yep.
Yes, thank you.
Yep. Still more to come on Your Carolina. Tons of artists are opening their doors to you, and we want you to shop small and shop local. We're going to take you on a tour coming up and show you some of the products that you can buy.